So I'm Dr. Jean Salcetti. I am a periodontist. A periodontist is a specialist in the field of dentistry that goes on past dental school to receive 3 additional years of training, primarily for the surgical treatment of not just periodontal disease, but for the treatment of other tissue or bone loss of structure. So we basically do oral surgery in the mouth to help rebuild the foundation, either around teeth, but if you lose your tooth and you need to put in some kind of a replacement called a dental implant, then we also can rebuild the bone, rebuild the soft tissues, place a dental implant, which is a titanium screw that goes inside the bone, acts as a root, and then a new tooth can be put on top of that to give you back your smile. So this very cool technology, coined LANAP, and it's LANAP, and those letters stand for Laser Assisted New Attachment Procedure. And basically it's laser therapy that allows us to bring energy from the laser quartz fiber, which is what this looks like right here. It's very difficult to see, but it's a very, very, very small quartz fiber that penetrates down inside between the gum and the bone of the tooth root, and basically that beam of energy finds all of those aggressive bacteria that are destroying the gum and the bone around the tooth, known as periodontal disease. And what that beam of energy does is it identifies those aggressive bacteria and annihilates them, which is the coolest thing ever. And so when those bacteria are gone, it also removes any of the infected tissue that's between the tooth and the tissue. But the best thing about it is that the laser beam passes through all the healthy tissue cells. So it doesn't take away all the tissue and all the healthy bone. It only removes those cells of tissue that are infected with the bacteria. And these bacteria penetrate not just in the tissue, but along the ligament of a tooth and into the bone and even into the tooth itself. So this laser beam of energy, it's like the rays of sun. It just spreads deep into the tissues and finds all of those aggressive bacteria and annihilates them. So that's phase 1 of the laser treatment. And then the second part of this is where we go in and we remove any of the tartar or the debris that's formed down along the root surface. It's very toxic. It's like a coral reef that's just teeming with bacteria that's releasing all these toxins, and that's what destroys the gum and the bone. So we have to remove that barnacles on a boat, so to speak. It's mineralized to the root surface, so we scrape and we clean all that off. And then you can imagine that the tissue's been a little roughened up, so in order to get this to heal, we then do another setting on the laser, and with that different setting, it then actually triggers and releases all the right cells inside the tissue to create and produce fibrin. Fibrin is the body's first response to healing a wound. And when that fibrin is released, we have a nice clean tissue, we have a nice clean tooth, and then that releases the fibrin. The fibrin's a nice sticky substance, and what that does is it allows the tissue to stick to the nice clean tooth. So this way we don't need incisions because the laser beam goes in and creates the wound for us, and then the second pass of the laser beam allows us to reattach those tissues and avoid having to use sutures to stitch the wound back together again. So the best thing about this laser treatment is that it's so not invasive, unlike having to make incisions in the tissue and pull the gum away, and that's still procedures that we do in periodontal surgery, but many times when we're treating periodontal disease, the best technology out there is laser therapy. When we have a mouth that has full disease present, the coined term is LANAP. So that means we're treating every single tooth surface around the mouth. There are many times a patient has just an isolated pocket or a deep area, and we'll go ahead and we'll just treat it with laser surgery.